Hello, I am Charmaine Tyler. I'm a psychologist at the University of Texas Health Science Center in Houston, and my colleague, Dr. Deepa Iyengar, and I are presenting our project, The Role of Narrative Strategies for Cultural Competency Training in a Family Medicine Residency Program. We really decided to take on this project because we recognize the importance of training our residents to be culturally competent physicians. In primary care, this is clearly a priority in our current global economy, but even more specifically for us living in Houston, one of the most diverse cities in the country, we see a wide array of patients from young to geriatric, from many different parts of the world, all different types of socioeconomic backgrounds. And because our residents are working with these various types of patients across the community, we always want to make sure that they understand what it means to be culturally competent. But in integrating that into our curriculum, we also wanted to make it a bit more prominent and include some maybe novel strategies for introducing that. And so, one of the things that we started with were the ACGME requirements for incorporating cultural competence training in residency programs. And so, the various factors that they described as being important are not only to have educational opportunities, but also to have some patient input, also thinking about things like clinical experiences and how those help the resident to become more culturally competent. And so, again, we've got the clinical experiences, and we decided that we would really focus in on the educational aspect of this training. And so, in addition, we thought because our residents also come from varied backgrounds, we thought it would be interesting to start by having them do some reflective writing, to start to understand themselves and how they see themselves culturally, and maybe even how their patients may see them in terms of culture. And so together we decided we would first have some training for the residents in how to do reflective writing. And that was led by one of our physician colleagues, with an, a resident also was helping in a lecture to do some guided practice with her classmates on reflective writing. And then following that, me being one of the psychologists who does some didactic training for our residents, followed that with a couple of didactic lectures where we were talking about cultural competence, what the standards and guidelines are. And then in the second cultural competence lecture, we also talked about understanding our specific patient population culturally, and then reflecting on how that mirrors or differs from the actual culture of the residents themselves. And they were encouraged to use reflective writing to address this for themselves, and they were presented with an example of a physician's, Dr. Iyengar's, actual reflective writing about her own culture and how that plays a role in her practice as a physician. And then about 6 months after the initial guided instruction on reflective writing, the residents received a follow-up survey about their use of the strategy. And I did neglect to mention that before the first guided instruction, the residents completed a survey that just asked them about their current use of reflective writing. And as you can see in our results, there was really no change in their use of this strategy before they had the guided instruction, or even after they had the didactic discussions about cultural competence and were sort of encouraged to use it as a strategy to reflect on culture. So, in conclusion, we really think that this is a unique modality for helping our residents to reflect on cultural, especially in such a diverse practice setting like we have here in Houston and with a pretty diverse class of residents. But we definitely need to refine our approach and maybe assess change in cultural competence and also incorporate some resident feedback about what sorts of experiences they currently have or would like to have that help them to learn about cultural competence. And we also just started this as a pilot, and so we recognize that reflective writing is not the only narrative strategy that we can use. Of course, there are options for video voice, which many programs are doing, and stfm has reached out to ask people if they're interested in participating in that, but also just some basic storytelling that can be used. So we want to make sure that we are getting some buy-in from the residents before we proceed with this curriculum. But overall, we thought that this was a good first step into having some very specific cultural competency training with our residents using a unique and interprofessional approach. Thank you. Hello, I am Charmaine Tyler. I'm a psychologist at the University of Texas Health Science Center in Houston, and my colleague, Dr. Deepa Iyengar, and I are presenting our project, The Role of Narrative Strategies for Cultural Competency Training in a Family Medicine Residency Program. We really decided to take on this project because we recognize the importance of training our residents to be culturally competent physicians. In primary